to Mayo Medical Laboratories Hot Topics. These presentations provide short discussion of current topics and may be helpful to you in your practice. Our speaker for this program is Dr. Glenn Roberts, a professor of laboratory medicine and pathology and microbiology at Mayo Clinic, as well as a consultant in the Division of Clinical Microbiology. Dr. Roberts discusses disease-causing dimorphic fungi and how to identify them in culture. This presentation examines Coccidioidomycosis. Roberts.
Thank you, Sarah, for that introduction. I have nothing to disclose. The diseases caused by the dimorphic fungi include the ones that you see on this particular slide. First three are seen most commonly in North America, and Coccidioidomycosis is seen in Central and South America. The others are that you see here. Sportricosis is seen in the U.S. Penicillosis is seen pretty much in the Far East. These are things that we will see in the clinical laboratory. They're caused by fungi that are called dimorphic fungi, and that is that these organisms happen to have two growth forms. They have some particular features that we will go through that are in common to all of them, and the growth rates are relative, and that depends upon how much organism is present in the clinical specimen that you start off with. It depends upon the culture medium that you use for recovering the organism, and it depends upon how much organism is present in the clinical specimen, as well as the metabolism of that particular organism. One of the things that helps in some instances, and not all, is blood enrichment, and we include media most of the time that have a blood enrichment source so that we can pick up some of the fastidious organisms. The microscopic morphology, there's one thing that's in common with all of them, and that is that they produce small septate hyphae. There are a few other things like dermatophytes that can do the same thing, but by and large the dimorphic fungi are the ones that produce these hyphae. We do have molecular methods that are available for identifying these organisms in addition to using traditional methods. We have nucleic acid probes, we have nucleic acid sequencing, and MALDI-TOF that is now being used in the clinical laboratory that will identify these organisms much more easily than traditional methods. This image shows you the small hyphae. It's hard to tell on here if they're septate or not, but they are septate and very tiny in size, like 0.5 microns. The dimorphic fungi have colonial morphologic features that vary depending upon the isolate and also upon the medium in which these organisms are recovered. So that you can have one organism that you can place on two different media and they will look differently on either. The colonies of histoplasma and blastomyces are pretty much indistinguishable from each other. The colonial morphology sometimes is not helpful at all in terms of identifying these organisms. This particular discussion is going to focus on Coccidioidomycosis. We will talk about the organism Coccidioides-ematus/Possadisi. Coccidioides-ematus is the organism that we have been dealing with for many, many years, and it's been found that there's another strain that it genetically differs from Coccidioides-ematus. It's called Coccidioides-Possadisi, and it doesn't differ in terms of its colonial morphology or its microscopic morphology, but rather its nucleic acid makeup. Where do we find this organism? It is found in the southwestern part of North America and also in Central and South America. This slide here shows you a rectangular box that includes primarily the areas where you see Coccidioides-ematus in the United States. It goes from western Texas all the way to northern California, and that's pretty much where you find it. You don't generally find it anyplace else. There are times whenever you can recover the organism from patients who happen to be in an area that is not endemic for coccidioides, and it may have something to do with the fact that they travel there during the winter months, came from a cold area, traveled there during the winter months, and came back home with it. Sometimes there are fomites that have been sent from one part of the country where coccidioides is endemic, sent to another part of the country, and someone opens the package up and they get exposed to the spores of these organisms. This is a map that shows you kind of where it's found in the world. Coccidioides is found, as you can see, in northern California all the way to western Texas and down into Mexico. There are a couple little black dots in Central America. Honduras is one of those places where you see it. I happened to visit there a few years ago, and they see it every day. People walk in with the disease. So we know it's found in Central America, and we know it's also found in South America, pretty much in every country except Chile. Where do you find this organism? Well, we know where this organism is found. It's found in the soil of the areas that typify what's called the lower Sonoran life zone, where the conditions are semi-arid and dry. The temperatures reach 100 degrees or more Fahrenheit during the summer months, and then in the wintertime, temperature falls all the way down to freezing or sometimes even below that. The soil has a very high alkaline and salt content. If you look what grows there, you will see that the vegetation is short, stubby type shrubs like the creosote bushes, the mesquite trees that are not very big, cacti, particularly the saguaro cactus, and yucca plants. It's kind of the typical environment that you see in Arizona, in Southern California. And a lot of times there are a number of animals, small rodents that burrow down into the soil, and sometimes they're actually the culprits that bring this organism to the top of the soil. They have to let the wind carry it along or let us pick it up whenever we happen to be working the soil. This is an example of the lower Sonoran life zone. You can see that the saguaro cacti there, the kind you see in the old Western movies, and this is the type of environment where you find Coccidioides. And people who go out hiking in those areas, who go out poking around the soil looking for something, are the ones who get it. People who go on archaeologic digs are at high risk for acquiring Coccidioidomycosis in an environment like this. What happens to this organism? Well, it disappears from the soil during the wet months. It goes down a little bit deeper in the soil. And then when the summer months and spring months come, the soil begins to dry out and the organism sort of comes to the top, and then the winds disseminate these spores that are the infectious particles of this organism around in the environment, and they're there for us to inhale, for small rodents to inhale. Anything that happens to be around can actually become infected by this organism. So anything that disturbs the soil, including the wind, is what's going to disseminate this organism throughout the environment and make the spores available for us to inhale. What kind of activities are associated with acquiring this infection? We kind of already talked a little bit about that, but construction out in areas where this organism is endemic is a very substantial source for getting infection. The archaeology digs is another thing we talked about a few minutes ago here that is responsible for causing a great number of infections. But people who work in agriculture in parts of Arizona and California who are out picking all sorts of vegetables and so on that disturb the soil actually inhale this organism. And then one of the big things that spreads this to huge numbers of people are dust storms that you see in the western part of the country that blow these spores all the way up to northern California from southern California and even further away than that. This is an example of an advancing dust storm. Your photograph was taken in Kern County, California, and if this was in northern California where they hadn't seen this organism, they woke up in the morning and found their cars were just covered with dust. Well, what they didn't know was not only was it covered with dust, but it was covered with arthroconidia of Coccidioides. And so there were many cases of Coccidioidomycosis in Kern County as a result of this dust storm that was seen there. This schematic shows you kind of what happens. Lower left-hand side, what we see are hyphae that are broken down into these arthroconidia. Arthro means jointed. And you can see that the spores there, after the first arrow going from about 11 o'clock, pointing to the right, you see these arthroconidia. What happens is the arthroconidia are formed, and as they grow, there becomes a dead space in between the arthroconidia. They're called alternate arthroconidia. What happens is that the wall behind each of these arthroconidia breaks apart from the dead cell between them, and it gives the appearance of what look like little wings on them, and allows them to float in the environment for a long period of time. So in this schematic, we don't necessarily see alternate arthroconidia, but I will show those to you as we go along. But what you see up there, the saguaro cactus and so on, is like the lower Sonoran life zone. These things are aerosolized by whatever source, whether it's a wind or whatever it is. If we take it into the lungs, and you see on the right lung, what happens inside there is that the spores come in, those arthroconidia come in, They then convert to round cells that are not yeast cells like we see with all the other dimorphic fungi, but they convert into round cells that are called spherules. And in time, these cells begin to produce what are called cleavage furrows. You can see in the lower middle of the diagram where you see these cleavage furrows, and then in turn forms these some people call them sporangiospores, but they're really called endospores for the most part. And those are things that then begin to develop into new spherules inside the host, and the cycle goes on. And so when you take a biopsy from one of these patients who has active disease with Coccidioidomycosis as a causative agent, you see these spherules in all stages of development, and you'll see the endospores in there in some of the cells that you look at. Sometimes you see spherules that are just simply empty, but you have to look at the whole slide. Here's what happens. We've kind of already alluded to this. The hyphae begin to break down into rectangular arthroconidia. These things are easily aerosolized, and once they're taken into the lung, they begin to transform into these spherules, and as the spherules begin to develop, they begin to replicate internally by a process called progressive cleavage, and this divides this internal cytoplasm up into what are called endospores inside the spherule. And then as time goes along and these spherules begin to mature, they break open and the endospores are liberated and they form more spherules, and the cycle goes on. What are we going to select for culture and for direct microscopic examination? Well, we have a number of sources that we can find this organism in. One's the lower respiratory tract, like most all the dimorphic fungi have, where they cause pneumonia. Most of them do, not all. We know that with Coccidioidomycosis that sepsis is a common manifestation, disseminated disease. Coccidioides involves the bone. It causes lesions in the brain. It can be found in the spinal fluid. Meningitis is a common feature of Coccidioidomycosis, and it's also a very serious one. You can find it with the skin and also the mucous membranes, particularly the oropharynx. You can find it causing arthritis, and you can find it causing abscess of the subcutaneous tissue. So pretty much you can find it almost any place. So what are you going to see if you look underneath the microscope at a specimen that may have Coccidioidomycosis in it? What you're going to see are these rounded spherules. Some of them may not have any endospores in them at all. Others may look like what you see here. Using calcifer white, you see the large cell that is the spherule, and coming out of that ruptured spore are all of these endospores that, if left in the patient, would then begin to turn into individual spherules in time. This is an example of a biopsy. This is the H&E stain showing you a large spherule containing numerous endospores, and the H&E stain shows them pretty well. You can see it also on a methenamine silver stain well. This is a culture of Coccidioides, and one thing we do know about this organism in terms of culture is that for the most part it grows more rapidly than all the other dimorphic fungi. It'll grow up within 2 or 3 days and form arthroconidia in a time a little bit close to that time or a little bit longer than that, but the colony begins to appear 2 or 3 days. As it matures, it will form these arthroconidia, and I can't give you a time as to how long it takes to form them, but I would say 4 to 6 days, the arthroconidia are going to be there. And so this is the most infectious of all the dimorphic fungi and all the fungi, period, to handle in the clinical laboratory. There have been numerous reports of cases of laboratory-acquired infection and death caused by this organism. So it grows up as a fluffy white mole for the most part. But if you looked at photographs of 100 isolates of this organism, you probably would see 100 different morphologic features on these colonies. They can be yellow, they can be brown, they can be pink, they can be red, they can be white, tan, all sorts of colors. When you get through with this thing, you may say to yourself, geez, I wonder if I threw one of those things out, because it does happen. This is another example of colonies of Coccidioidomycosis or Posodidae. What you see here are 2 colonies side by side, and they're heaped up in the center. And that's a common feature for some of these isolates that we see. They're dome colonies. This is a colony on a blood-containing medium and it almost looks like it has a little bit of a green color to it. Sometimes you see that this blood enrichment is helpful for recovering coccidioides, but not as helpful as for some of the other fungi. This is one growing on a blood agar, and you can see that in the center it's domed, and in the periphery it's kind of more fluffy. And this is the example of those dome colonies we talked about. This is another example of what we see with coccidioides, and we kind of refer to these things as cobweb type colonies. What happens is the center begins to kind of domed up, and the periphery begins to be more adherent to the agar. If you see a colony like this, it's pretty representative of Coccidioides /Posadice. This is an example of a plate where we use cyclohexamide to recover the organism. All the colonies there are Coccidioides except the one at 3 o'clock, and that's probably Penicillium or some other saprophyte that we had happened to get into the culture plate. You can see those dome colonies. You can see the kind of cobweb type colonies that we were talking about, and this is common to find these. This next slide shows you a plate of blood agar that was used in the bacteriology laboratory. Those are the 3 colonies of Coccidioides immitis. What you don't want to do is to open this plate up in a bacteriology laboratory without being inside of a biological safety cabinet. For the most part, the colonies may not have time to mature when they begin to look like this. On the other hand, I wouldn't trust that, even if I said it to myself, because I think that there are exceptions to all this, and what you don't want to do is have a laboratory-acquired infection and get a big dose of inoculum from opening up a plate like this. What you do is you open it up underneath the biological safety cabinet. This is chocolate agar, showing you the colonies of Coccidioides immitis that grew up in the bacteriology laboratory. The rule of thumb is that no cultures of moles should be opened up in the room. They should be opened up, and not on the bench, should be opened up in the biological safety cabinet. These are some colonies I'm going to show you that vary, and they are just different isolates. This one looks almost gray. Can you see the center is kind of domed up? And this is an example here of some of the colonies you've already seen, but you show them on 3 different media. The top 2 plates containing blood enrichment, and the bottom one is sabrose dextrose agar. And they look different depending on the 3 plates. And they're all the same isolate. This is an example of 4 different culture media, same isolate, and you can see the 2 blood-containing media look about alike, and also the 2 non-containing blood medium look a little bit alike. You have to become familiar with what these organisms look like on different culture media to be able to recognize them, at least suspicion what they are. Now, the next slides I'm going to show you are maybe a little bit surprising to some of you who are looking at this, because there are many colonial variants of Coccidioides immitis /Posadice. I'm just going to go through them and you can look at them. This one looks very glabrous, not really yeast-like, but just kind of membranous. This slide shows you again another one of these colonies. It looks membranous, and this is Coccidioides immitis. It doesn't look like what we've talked about earlier. This one, including all the colonies except the one large colony about 3 o'clock, is all Coccidioides immitis. Doesn't look white and fluffy or membranous either. This one looks like something you probably would throw away, except for the tiny colony there that's a bacterium. This is all Coccidioides. And this one, except for the large colonies there that are yeast, is Coccidioides. It almost blends in with the culture medium. And this is Coccidioides. Doesn't even look like anything that's described in textbooks. There are a lot more variants of Coccidioides that we could show you. And again, I keep saying this, but you wonder sometimes how many of these did we throw away because we thought they didn't look like anything that we should worry about. How are we going to identify Coccidioides immitis? We're going to look underneath the microscope at the microscopic features of this organism from the colonies. And you're going to start off by noticing one thing that's in common with all these dimorphic fungi, and that is that they have small, delicate hyphae present. With Coccidioides, we find some structures in there that we don't see with some of the others. They're called racket hyphae, and they look like tennis rackets. It looks like a swollen area that may be at the end of a hyphal strand or in the middle of a hyphal strand that's produced in these young cultures. And they're just called racket hyphae. What we see, though, that are characteristic for this organism are alternate arthrochonidia. The arthrochonidia are the jointed spores. They produce an arthrochonidium, and then they produce a dead space, which is called a disjunctor cell, and then another arthrochonidium, and it just keeps on going. So they're called alternate arthrochonidia. And one thing that is important to look at, because there are lots of these fungi that produce arthrochonidia, one thing to look at is to look at the size of the hyphae that are producing these arthrochonidia. The hyphae are a whole lot smaller than these arthrochonidia, so the hyphae that produce your arthrochonidia are smaller. These arthrochonidia can be barrel-shaped, and a lot of times they are that. They can be rectangular or even rounded in shape. You generally do not see spherules or endospores on culture media. You see these alternate arthrochonidia. On this image you can see these are the racket hyphae. These are the alternate arthrochonidia that we're talking about. But these structures here are the racket hyphae. There are racket hyphae on here that are not as good, and you can see that they're the kind of racket-shaped type structures on there, but they don't all appear to be textbook perfect, I can tell you. This is another example of racket hyphae, and you can see them scattered throughout there. This is an example now of the early development of the arthrochonidia. If you look at the hyphae of Coccidioides in there, you notice that the hyphae themselves are very small. But look at what's beginning to develop in those. And those are the arthrochonidia that are kind of barrel-shaped. They're much larger than those hyphae that produced them. And that's what you look for when you're looking for Coccidioides. That and the fact that they produces these alternate arthrochonidia. Now this slide here shows you the alternate arthrochonidia. The arthrochonidia are the rectangular cells, and then there's a clear space in between them. The clear space is called the disjunctor. What happens is the cells break apart in that clear space, and as they do that, they take a part of the wall of the cell behind them, the disjunctor cell behind them, and on either side actually, and it just adds a little piece of disjunctor cell on either side of the arthrochonidium, and it allows it to give some lift to these spores as they float around in the environment. In this slide, you see a lot of arthrochonidia, but you don't necessarily see a real prominent clear space in between them. So you have to look at everything, and you have to look at them closely to see if you have alternate arthrochonidia or not, because there are lots of organisms that actually are found in the soil in that part of the country where you find Coccidioides that may be a bit confusing. Here's a very good example. It's an old slide from the Centers for Disease Control that shows these alternate arthrochonidia. On the strand at the bottom, you see there's a rectangular spore. Some now look a little barrel-shaped. There's a clear space between them. That is what we're talking about with mature alternate arthrochonidia. And here you can see the disjunctor cell and then the arthrochonidium on either side.